Hello, my name is Laura Sarah Kent Hemeloff. This audio is about my model health voucher system. The disability support pension of up to $400 per week for people not able to work 15 hours per week and health budget of similar size would merge into a single health voucher system. This would save $50 billion per year. Each disabled person would receive health vouchers of $400 per week minus 0.2% of assets per week and 10% of income, paid into the disabled person's healthcare savings account provided by an insurer, used to buy insurance for treatment of pre-existing and emerging illnesses. 90% of the cost of private specialist treatment would be paid for by the insurer. The patient would pay 10% of the cost as a co-payment from the patient's health voucher savings account. The co-payment would have patients' moderate demand away from most expensive low-value treatments in favor of specialists providing maximum product quality for minimum expense, such as the best filling for minimum cost dentist. Treatments would be limited when reaching a cost of 10 times the value of premiums paid by the citizen in the last year. Insurer would be paid 20% of insurance payouts to encourage insurer to make larger payouts and to pay for health information systems. Patients as health product consumers would refer to online reports in Wiki Treatment Guide from other patients and medical product web page from insurer listing specialist health product details and pricing. The patient could also make a free call to their insurer's telehealth direct call center for extra advice and to ask for a treatments assessment consultation. The insurer would offer and recommend from a range of highest quality private specialists competing on healthcare product quality and price. Once the patient chooses a covered treatment, the insurer would telelink through referral and appointment information to the appropriate private specialist. After each treatment, patients would be required to fill in an online report about the treatment experience to guide other healthcare consumers, much like eBay. Covered health specialist would have to provide good value for money health products to retain insurer accreditation. Making indemnity insurance illegal would also focus specialist doctor duty of care. This would reduce costs for good doctors and make bad doctors pay for own mistakes. Patients with time to do own research about their ailment would be vastly more knowledgeable about possible cheap complementary treatments for their particular ailment than general practitioners. Patients could quickly use real-life experience to test a range of complementary and nutritional treatments to solve own complex health problems. Some expensive treatments do work, but more life would be saved under health voucher choice of cheaper remedies than would die earlier from termination of GP-controlled super expensive treatment misadventure. Any person having suffered an ailment, who is in remission, who has experience of treatments as a patient and is healthy and has trading qualifications paid for from a 10% trading levy on private revenue, and who has accreditation from an insurer should be authorized to be a specialist for the insurer for treatment of the particular ailment they suffered. Because half of health voucher would be saved, voucher budgets could be 2 times over-allocated, so provide more vouchers to disabled citizens in real need. Children's health care would be paid for from 10% levy on corporate revenue to sponsor children's boarding school health care. Compulsory mental health, if required, would be paid for from a 10% emergency services levy on corporate revenue. Aged and disability homes and hospitals for care not treatment would be paid for from 10% of the national budget and then privatized. Thank you very much.